I want to show you a few key findings in hip arthritis on examination. This poor gentleman has some bad hip arthritis. So one of the things I do is I bring the hip up to about 90 degrees. And one thing with him is in bad hip arthritis, you might have something called obligatory external rotation. So I'd bring the hip up straight, I'll have you relax, and then the hip just has a tendency just to turn out. It tends to externally rotate without me even trying or him fighting me. But even this, he's like, ooh, he doesn't like that. So that's kind of one thing, obligatory external rotation. When I go like this, as I'm turning his foot in, that means his hip is internally or externally rotated. And then here the hip is internally, he's like, ow, ooh, you don't like that, do you? That's painful. So that's one key finding is they lack internal rotation. The last thing, there's a test called the Faber test or figure 4 test. Many times I'll put the foot on the opposite leg. That's actually a little too uncomfortable for him. Now I want you to relax this knee to the side. And what I'm looking for is there lack of motion and is there pain? So tell me, point to me, where do you feel that? So he's feeling that there, and you've even felt something kind of in the front, right? So that is a key finding also in hip arthritis. Now, this can be a test also for SI issue. They tend to point to the very back of their buttock area. But usually, notice he's stiff with this. He doesn't like this, especially if I were able to put his hip up here. So obligatory external rotation, really poor internal rotation, and then this figure 4 test are three key findings in someone with bad hip arthritis.